At Bournemouth University, with some research, we looked at 3 areas. We looked at the extent to which fathers needed support if their partner was experiencing poor mental health after having a baby. We also looked at the extent to which they needed support for their own mental health, and we also did some research to explore those fathers who might be in the delivery room. When it all goes wrong, they've witnessed a birth trauma, what kind of support do they get? And that was the 3 studies that we did.
I became a new father roughly 4 years ago now, and some of the pressures that I put on myself were I really wanted to be involved in all aspects of parenting and being around and being active. I was really struggling, I think, with the lack of headspace, lack of free time to stop, to think. So one of the steps I took was to have some counselling.
What we found in this research, and it cut across all 3 studies, was a common thing, that fathers weren't being sort of recognised that they could even develop mental health problems after the birth of the baby. But perhaps even more importantly was that the health professionals who are involved in this period, midwives, health visitors, weren't actually bringing fathers into that equation, asking them the questions, how are they? Asking them about what kind of support they need.
One of the things I think I'd like to see more of is more support for new fathers. The health checks when the health visitor comes to the house. I think there's a lot of focus on mother and baby, but I don't really feel that there's much there where someone checks in with the father as well.
The evidence that we found in this research has made a lot of difference, and it kind of dovetailed with what I was already doing in terms of campaigning, either through the media, social media, and even in some cases attending meetings in Parliament. Now, NHS England have announced that all fathers will be screened for their mental health, and Bournemouth University research contributed to that decision.